This is Sangeeta Reddy, distinguished delegates. It's really my pleasure and privilege to be again here with eIndia for two reasons combined. One, because I worked for a long time and associated with IT in this state and this country. Second, because I am currently in the health portfolio. So eHealth track combines both these areas where I had been working in the recent past. Now, when we talk of transforming healthcare through technology, I think it's really loaded with a lot of big words, and we have to be clear what we mean by these words. Transformation, for instance, is quite a big word, especially juxtaposed with public health care. Because transformation, we mean a radical, fundamental change, almost revolutionary change in the way things are done. And in healthcare, at the end of the day, it boils down to delivery of services to the medical and health services to the citizens. So what are the various areas in which radical change can be made? First of all, with or without technology, then of course wherever technology can fit in. I think it's the landscape. I've been at the helm of this health department for a year and a half now, and it's a mind-boggling landscape, such a wide landscape, big landscape, and very important, sensitive also at the same time, and numbers are extremely large. But very quick, analysis tells us that the choices, now that it's such a wide and big area, you need to necessarily prioritize. You have to divide the whole sector into some segments and then prioritize, because you can't do everything everywhere. For instance, you can choose between primary, secondary and tertiary care. Where is the impact going to be maximum? One can easily say, okay, why not cover everything, primary, secondary, tertiary? But it is a question of resources, it's a question of resources being available and achieving success in so many fronts. They are totally different things. Applying technology in the primary care, for instance, is totally different from applying it in the tertiary care. I will give small examples little later, but these two domains are completely different. So you have to make a choice there. The second area where choices need to be made is one of the public or private. How much emphasis should be given on the public health care and how much on the private health care while planning. Third again is preventive versus curative. This is again big divide. How much emphasis on preventive aspects and how much on what will be the value for money, what will be the return on the preventive side and return on the curative side for a dollar spent in either way. So I think these are all strategic decisions as to, while the vision could be clear, but it's not as if we can reach that or achieve that in a day or a year. So, one has to make strategic decisions in these areas to what I am going to do. Especially if you are talking from the position of the government or the state, these choices become quite relevant and pertinent. Now, in any of these areas, again, vertically you have other issues which need to be addressed. For instance, the topmost concern for the health sector is the availability of qualified personnel. The management of human resources is the biggest area of concern. In my own department in this state, we have 100,000 employees, with over 20,000 of them being doctors and rest of them paramedical and sub-staff. So it's a huge workforce that we are talking about. How do you manage, how do you ensure that they perform and that performance is measured periodically and so that the delivery is effective and there are no inefficiencies in that. So the people area is very big and it is ideally suited for technology, application of or deployment of technology in my view. The second area is of infrastructure. Second pillar I would say in the healthcare is the infrastructure. Whether it is the service centers or whether it is the hospitals. A lot of infrastructure in the form of civil infrastructure as well as biomedical equipment, infrastructure. With the accent on, more and more devices coming in. I think just like IT, information technology per se, or pure IT, even medical technology has undergone significant changes and today I think if you enter any corporate hospital, sorry Sangeeta, but before you get to see the doctor, you have gone through a number of machines and a lot of reports are on your hand before doctor can see you, a real specialist can see you. So the fact is, I'm not passing a value judgment whether it is good or bad or whatever, but that is the situation today. So, and each one of it is, behind each one of those machines is a tremendous amount of technology, tremendous amount of information technology. Interfacing all that, integrating all that into a working hospital is really, again, a task, a challenging task. So infrastructure itself is another big area where technology should play, is already playing and increasing role it should play in the future. Third big area I come across day in and day out is one of management. Management of the delivery of services, which means that how do you manage your people, how do you manage the finances, funding issues, etc. The logistics, procurement. So any number of these areas is again, and the supply chain management. Let me tell you that in a state like Andhra Pradesh, we have 2,500 health institutions where the services are provided. And we have medicines, about roughly 400 types of medicine, each comes with different combinations. And equipment of about 1,000 varieties of equipment. Imagine kind of logistic problems. Very often we are accused in the government of a mismatch between these. Either the specialist, the equipment